Good afternoon, everybody, and welcome to this very special CPD webinar, Clearing the Fog Around Menopause in the Workplace. I'm delighted to be joined by one of our esteemed fellows, Stella Amor, who's part of our DEIB Council here at the Institute, and also a long friend to the hospitality industry. I'll let Stella introduce herself in a moment. But just before we start, just some housekeeping items to run through with everybody today. So the next hour or so that we've got together with each other does count towards your CPD points or your hours, the 30 hours that require all members to complete throughout the year. So please remember to add this into your records. If you do have any questions that you'd like to ask Stella throughout the webinar, please do ask them in the chat box, and I'll be back later to ask those to Stella later on. That's it from me for this point. So I'll hand over to Stella, and I'll be back towards the end to ask Stella some really tough questions, hopefully. So
Thanks, Sam.
over to you, Stella. Thank you.
Thank you very much. Thanks, Sam. Well, first, delighted to be here. Thank you for having me join you today. So welcome for all of you joining online live, or those that are tuned into a recording. I'd just like to tell you first a little bit about myself and my partner, Kelly, who, first, apologies, is for unforeseen circumstances, can't make the webinar today. So if we can move on, I do have a trusted tech assistant, Joe, in the background. So ready, Joe, to move on. So who am I? I am Stella Amor. I've actually been in hospitality over 30 years now, which sounds really shocking. Always working in hospitality or luxury services. And I've worked originally in operations, probably for the first half of my career, all the way up to hotel manager, to really understand the ins and outs of an operation. Then I studied again and I switched to HR, where I spent over 20 years of my career, either as Director of People and Culture or D&I, and also involved in leadership coaching. I'm actually a qualified and licensed coach and consultant, and my main area of expertise is pro change and transition within our hospitality sector, always with well-being and inclusion at the core of what I do. So let me just tell you first, I think it's important when we talk about menopause to share a little bit of a personal perspective on this too, not just the qualifications behind it, but I actually used to be very naive about menopause. I think from a personal and professional probably perspective, really, you know, when you're much younger, sometimes it's very rare for you to see what could be coming and how it could impact. But my experience with menopause or perimenopause is actually forced upon me. I faced a traumatic experience in 2020 when I caught COVID. And I spent 5 months in intensive care, having been in a coma for 6 weeks. And ironically, when I first went into hospital, sorry, I think we're going forward there, Joe. Originally, when I first went into hospital, I was on my menstrual cycle, so I was having my period. And funny enough, a week later, it drastically just stopped. So my body had gone into trauma, which can happen, and actually brought on the onset of my journey straight away. And it impacted me quite severely. And when I came home 5 months later, came back, my periods with a vengeance. So I had a whole 5-month period, if you pardon the pun, with no menstrual cycle at all, and then started gaining weight. Periods came back, menopause symptoms, and actually I kind of lost my way. I couldn't find out what was trauma and what was menopause. And more importantly, what was going to be in my control and what was not. And I think since coming home, I kind of worked on my health, physical and mental, and I wanted to be educated about all of this. And this is where the journey went into actually trying to understand what is trauma. That's what I'm doing now, but also a little bit more about the menopause journey and what I could do about it. So through that journey of education, I qualified through Cornell in D&I, specializing in disability, but also I then went on to become a counseling career coach for leaders and HR professionals, and also qualified to deliver menopause coaching training during that. And that's actually how I met Kelly. You can see her lovely picture, so she's not here today, but you know, I met her during that journey, and actually we had the same passion to help others through inclusion and well-being. And now we've created a Wellbeing-Trusted Circle company, and we launched a program called the Menopause Puzzle. So let me just tell you something about Kelly, just so that you're familiar with who my partner is in this. She's actually also an independent HR consultant, trainer, licensed coach with over 25 years of experience in senior HR, and actually spent most of her career also driving people-centered change. Real focus also in her sector, which was finance, but we got to see a lot of synergies in our sectors. She also runs different coaching programs in terms of lifestyle and things like that. And she also had a very personal experience with her perimenopause and found that she actually was a bit naive about some of the symptoms there as well. So Kelly and I really want to change the narrative for others, and that's why we're here. We're using our HR expertise within organizations, mine in particular on hospitality, so hence speaking to you today. And what we've really found out is that if others are a little bit educated and we prepare and discuss and actually kind of influence an environment in the workplace that can support this transition, we'll actually have a healthier and happy life and workforce that can go on to thrive, right? So that's the objective, I'm sure, of all of us here today, to try and learn more. So that's us. Thank you, Joe. So right now, just FYI, we're going to cover quite a lot today because there is a lot to cover. So it's not something you would normally do in just 1 hour. So it's really top tips today. I'll leave a bit of time for Q&A at the end. So please keep putting any questions in the chat as we go along. I know that Sam will pick those up and grill me on those later. However, I'm always happy to have a trusted conversation at any time, and I'll share how you can reach out if you've got more personal things. So please avoid putting anything confidential in the chat if it's something personal, and don't mention any employee names. I'm sure that's a given, but yeah, let's keep this really just top level today, but you've certainly got a direct line to me if you need. So today's webinar is about understanding and listening to hear and gain inspiration to take action in the workplace where you can. Thank you, Joe. So, deeper understanding of what menopause is what I'm going to cover, because I think without that, we really can't take any initiatives into the workplace. I'll just touch on some legal risks just so that we understand that area, although I've got to say that we cover that a little bit more in the training that we do in the workplace, because we can make it also a bit tailored for you. But it's really about raising awareness, right, of what support is available for colleagues and their family members, because remember, it actually affects more than just your employees directly. Thank you, Joe. So let's just say, what is menopause? So menopause shouldn't be a taboo conditional illness or classified in that respect. We want to promote menopause as a normal transition that it is, right? It needs to be normalized. Really, we need to remove that stigma. Got to understand that actually how many people are going to go through menopause in their life. So realistically, it's about making that journey and that transition as easy as possible to navigate. Without the right support, that's where it becomes debilitating and has really serious consequences. So I think we need to take that piece a little bit seriously. So if I actually say what the word menopause is, okay, it's really interesting because actually it's where our ovaries cease to produce and consequently our estrogen, our progesterone and our testosterone levels decline. That's what we're talking about. And I'll talk about that in a little moment. But what's happening here is our menstrual cycle still happening. And that period of having symptoms and that decline in our hormones is what we call perimenopause. So the term menopause itself, believe it or not, is 1 day. So you are actually in menopause 1 year after your last menstrual cycle. So other than that, we have perimenopause that happens before that. And then we talk about menopause and beyond. Yeah. And so we go through all of this. So on average, I mean, how long do you think perimenopause can last? Just have a think about it. A lot of people never seem to understand this piece because according to research, it can last anything between 3 and 8 years. But symptoms itself, this is a scary bit, could actually be anything from 2 to 15 years. Sounds like a pretty big chunk of your life, right? Going through all these massive changes. The average age, and you may have known this already, but in the UK is age 51. So if you think about when the symptoms might start, you're talking 45 to 55 might be, I say the usual, because there are exceptions, the usual time to go through this transition. There are other definitions that we, and actually medical terms if you like, but layman terms too, is something called early menopause. Early menopause is usually classified between 40 and 44. Before that, we actually call that POI, so that's premature ovarian insufficiency. So if anyone's going through this before their 40s, which can definitely happen, that's what that's referred to as. But the other thing to note is no two people will experience this journey exactly the same. And there are other influences. For example, all the stats I've just given you are really based on Western Caucasian women, because most of the research, unfortunately, today is mainly based in that community. There are lots of differentiators in ages between cultures, and lots of reasons that you might experience, or an individual might experience some things that others don't, and some might be genetics and other areas. Okay. We also know that other parts of the world, for example, influences this. So although more statistics are required, there's only a bit of research that tells us that the average age in Black communities, for example, is actually 48 to 50, as opposed to 51. Asian, usually anything from 48 to 51, and that depends obviously in where in Asia. So, and also what happens with different cultures is symptoms might present stereotypically different in different communities. So it's really something just to bear in mind, that although you'll see stats out there, they're usually based on Western and Caucasian women, which I'll touch on in a minute. But so let's not lump everyone into one area. That can be outside the box, that everyone's individual. So I mentioned my experience. So don't forget, you could also go into menopause naturally or medically or surgically, okay? And actually surgically or dramatically, like myself, is called cliff edge menopause, because you literally one day feeling okay, and then suddenly the onset is pretty triggering. You may have employees also that might be going through cancer treatment or things like chemo, radiotherapy treatment. There are also other illnesses, autoimmune conditions, that can also bring on the early onset symptoms of menopause. And I won't go into detail today, but really understand that it's not about being a medical professional in our employment situation as HR or leaders. It's about knowing how to signpost and just being empathetic and understanding. So what can we do to support that? I'm going to throw a question out there really for you just to consider, which is a bit staggering for Kelly and I when we found this out, but the youngest age of somebody in menopause, what do you think that might be globally? Just have a think in your mind right now, because I'm about to really throw something out there that is almost bewildering to think of. The actual recorded earliest age was somebody who was 9 years old, and that was in India. So can you imagine a young girl going through, obviously, her puberty phase and then straight into menopause? Almost unheard of, right? So again, really quite life-changing. And another thing is, half the working population is going to go through it. And this is why it's really quite important for us to take this seriously. So who's impacted? I keep saying women, right? But really what I'm talking about is those that have been assigned female at birth. It will affect transgender men, non-binary or non-gender conforming people can also go through menopause-like symptoms, okay? There are other areas, and again, not for today, but just top level, transgender women can experience menopause symptoms. Some males who have gone through prostate cancer treatment, it actually stimulates a hormone, which has a rise in estrogen. And again, they might get hot flushes and other symptoms too. So we're talking about menopause today, but I think we just need to keep an open mind that whatever you put in place in the workplace can actually be very inclusive to help a wider community within your workplace, right? So let's just take away the stigma, and let's also just take away the stereotype that this is only women in midlife. Not the case. Thank you, Joe. So we're going to take a little look now, ready for the next slide, onto symptoms. So how many think, I'm just going to give you literally 10 seconds to think about this. How many symptoms can you think of off the top of your head that an employee, a person, might feel in terms of when they say they're going through their menopause journey? I've got to assure that a lot of you are thinking about hot flushes. You can share in the chat. These are the common ones. Lack of sleep, night sweats. These are quite commonly referred to as vasomotor symptoms, but actually, Joe, if we could show the slide, actually, these are the most common ones coming up now, where actually they present in so many different ways, right? Everyone's got a different experience, as I mentioned before. Some women breeze through it, by the way. That's about 15 to 20% of the women. But the reality is 55 to 60% will have mild to moderate symptoms, and they may need to actually consider lifestyle choices or other areas to be able to support them through it. A minority group, if you like, about 25% actually have severe symptoms. Now, that's major intervention. This is actually about medical assistance, because that severe symptoms can actually debilitate you, affect your day-to-day functioning. If you think 55 to 60% mild to moderate symptoms, so we can kind of stay there for now. Any surprises out of all of these that you can see here? The most popular, the most affected one, actually, the one that comes up the most is sleep. Now you think about that in our sector of hospitality. Sleep impacts people, not just physically, but affects emotional and cognitive, right? So that's a huge one. And not only that, sleep then has a domino effect and starts to bring in other things, right? We're talking about fatigue in here. We're talking about, lots of other things, your immune being affected, your brain fog that a lot of people present with. Sometimes when you can solve the sleep one, it can actually improve lots of other symptoms too. So just bear that in mind when we're talking about shift patterns and back-to-backs and things like that on different ways that we might be able to approach this in the workplace. Thank you, Joe. This is top level, so please don't be overwhelmed by looking at this slide. But we've got to touch on what hormones are, right? What's going on? So I mentioned before, the three main hormones that drive a woman's monthly cycle are estrogen, progesterone, and testosterone. All three are actually instrumental in brain, bone, and heart cardio health. We actually refer to it as the BBC, brain, bone, cardio. So by addressing those three fundamental areas, you can already make a lot of improvements here. So imagine your colleagues going through menopause transition at that moment. Can you see in that piece there of perimenopause, the little dance that the hormones are doing? So whilst they're declining, they're actually a little bit up and down, right? So what's happening here is they're declining, but not just going zoom down, they're going up and down. And sometimes a person going through this journey can feel that way on a daily basis. Yeah. A lot of times, and if I'm going to stereotype now in terms of midlife, usually we said the average age is about 51 for somebody going through this. Now, if you imagine, that tends to be an age where you're working, doing well in your job, your career. Usually you have caring responsibilities too, right? Either for younger children who may or may not also be going through a hormonal change at the same time in that, imagine that household. But usually you've also got caring responsibilities, usually for the elderly or for other people in your life. So there's a lot going on for somebody going through that stage of life. Yeah. So it's really hard to suddenly turn around and say, you've got to focus on your own health, your own well-being. And we know drastically how the relationships change between employer and employee, if you like, especially since lockdown, if you like, because well-being now is not just, we'll look after our employees 9 to 5. There's an added pressure as an employer to say, right, Let's actually look after our employees 24/7. With that in mind, it's like, wow, their health and well-being, it's a lot of responsibility. If this is what's going on, do we really expect them to show up the same way at work every day? And what can we do about that? How can we help that? I'm not going to go deeper on hormones because it's probably a lot for today, but I thought it was important just to see a visual so that you can kind of understand what's going on here, that dance the hormones are playing. Thank you, Joe. So what's the impact of menopause in the workplace? Let's move on to that piece. And we can move along, Joe. So let's click through. So here we've got lots of stats in terms of what's going on in the workplace in terms of the menopause. So we know it's the fastest growing demographic in our workplace today. People are living longer. So it's not just the menopause transition, it's actually aging, right? So there's lots of things, again, that you're countering. This is about inclusion all round. Next one, Joe, if you just keep clicking. So here's some interesting stats again. 8 out of 10 women are going to go through it. Yeah, they're going through it now. Keep clicking if you like. Yeah. So these are some interesting stats, really. And if you start looking at this and apply it to your own workplace as you see these stats, yeah. Can you imagine 61%? This is according to CIPD here, have lost motivation at work. And that's specifically due to the symptoms they experience. How staggering is it to read that 10% of women feel they've had to leave their place of work? We're in a sector where we're fighting to retain. And here I could always say to you, you address this, I can guarantee, look, you've got 10% of the workforce right there. Yeah, pretty staggering number, actually, when you start looking at that. So if I said to you, right, if 61% of women in your establishment lost motivation, or 10% leave the company, what's the impact in your company business right now? And bear in mind, a lot of the time, either the women can't connect the dots because we're not talking about it enough, or number two, we're not talking about it enough from the workplace angle to put accommodations in place proactively, not just reactively. So that's what today's kind of about. Plant that seed of what can you do that's in your control in the workplace to give control to your employees navigating this journey and their loved ones, potentially, because it could be someone's partner outside of work that impacts on them too. Thank you, Joe. So now we're going to connect the dots. More stats. I'm just going to throw these at you rather than put them on the screen. But absence levels right now with people going through this transition, 50% of people researched by CIPD, it's quite a few thousand, 50% said they feel a bit depressed or they suffer from anxiety because of the transition. They're losing control of that journey. It affects productivity. 41% said it impacted on their performance. So poor concentration, looking at forgetfulness, brain fog, they feel like they're making more mistakes at work. Yeah. It impacts on attrition, so our retention. And actually, if this continues long-term, these symptoms, and they're not addressed, you're talking about more long-term absence, impact on health insurance if you have that in the workplace. So the other one is, and this is a staggering one actually, 11% of women that were surveyed, this is back in 2019 now, this stat, they haven't done it since, but there was a massive decline in women going for promotion within the age category. Is that an accident? Is that coincidental? If I talk about lack of confidence or making mistakes or performance being affected, I'll let you look at that. So what might impact in your workplace? What does the data tell you? And I guess I'm going to throw a question out just for you to consider, but are you even looking at the data? A lot of golden nuggets in your data, I've no doubt. Yeah. Thank you, Joe. So let's move on to the next one, Joe. We're going to look at the legal. This is where I actually wish I was presenting with Kelly, because I'm just going to take a breather And I'm going to walk the talk now, and the number one thing you can do is drink more water. So allow me to take a quick sip. Okay. Now, this is important because why? Gosh, the law, the legal requirements. We know that most cases, the legal requirement is the minimum requirement, right? It's the bare minimum you can do is be legally compliant. But we're going to try and look beyond the law for a minute. So if you just press one click, Joe, because what I kind of want to show you here is that actually, you know, to create a culture of belonging that leads to a culture of higher performance. If you could click one more time, Joe, for me. It leads to higher engagement, right? We know that actually what impacts our workforce really and the experience that they're taking shouldn't just be a tick box exercise. In hospitality, we're actually really blessed with such a diverse workforce, but to create and cultivate a supportive, inclusive environment for your team, that's our objective, right? It's not only the right thing to do, but it brings such significant work-related benefits for all of us. Happier, engaged team, lower sickness absence, greater productivity, happier guests and clients. Isn't that the goal? So I think the important of the focus is, yes, compliance and legalities is the minimum, but we're actually looking to take that a step further with all the inclusive lens that we try to apply. I think beyond this, obviously I'm not going to be amiss and not tell you anything, but we know we've got obligations under the law. We've got the Equality Act in 2010. We've got to ensure that our team members are not discriminated against or disadvantaged because of a potential characteristic, right? And we know that the law sets out 9 protected characteristics. It kind of doesn't look at intersectionality, but I'm going to look at it here. Why? Because whilst menopause is not itself a protected characteristic under the Act, the characteristics of age, sex, disability is protected. That means anything unlawful conduct by you or others in your company could lead to more discrimination claims. All right. Click one more time for me, Joe. Oh, sorry. If you could go back one, I think I've. Sorry, I seem to be missing a slide there. I'm just going to ask the question anyway. Let's go with it. So the idea really is, what is a disability? Do you think, and actually put the answer in the chat for me, do you think that disability, that menopause can be a disability? Can it be? I think for a second. What's a disability? So under the Equality Act, it specifically says if you have a physical or mental impairment that has a substantial and long-term negative effect on your ability to do daily activities. That's what we're talking about here. Is menopause a disability? The answer is no. Menopause itself is not. However, if the symptoms of it can be, so that's a little bit crazy to think about it like that, right? It hides behind different statistics actually under disability discrimination, usually sex discrimination, age discrimination, or a blend of all three. So a lot of the tribunals that have increased actually have increased, but with a mention of menopause being cited. So if I actually were to tell you that in 2021, there were 23 employment tribunals citing menopause within them, and that makes a 44% increase from the previous year. Yeah. And that's where they just mentioned, so they can't bring a claim under menopause, but they can under disability, sex, unfair dismissal even. But the word menopause was always mentioned. Over 207 times menopause was mentioned in 2021. Yeah. So it's just to make you aware that actually, is this something the right thing to do? Yes. Should you do it? Yes. But there's more reasons to, but we just want to understand that. So not a protected characteristic, but certainly should be protected in somehow. Yeah. So I won't go into that, but if you want more resources on this or case studies or anything, then please reach out. I'm happy to share a little bit more information or have a chat with you on that. Okay, thank you, Joe. So let's look at the impact. So I think I've just done that one. Thank you, Joe, again. Take a breather. So CIPD also, and these have been just double checked with other sources as well, by the way, but theirs is the most recent survey on this, but they reported 90% of the respondents in their survey felt they had no support for menopausal employees at work. Now, I know that's not specific to hospitality, and unfortunately, it would be great to be able to do this kind of survey by sector, because I know actually there's a lot that does go on that's really great in our sector, and I know that there's a lot we need to continue to do, but also there's a lot more maybe that we can't do still. So we know already that majority in our sector, we have employee assistance programs, but just think about that. How much do you yourself know about what it offers? And how much could it actually be incorporated into the well-being offering around menopause? Yeah. What support are you offering in the workplace for your employees? Do you have well-being champions or menopause specialists or people that could see through a different lens with the knowledge to look at your benefits? Is your training and awareness campaigns or your L&D team only delivering performance-related training? Or are we doing a lot more in other areas? What does reasonable adjustments look like in your company, for example? Yeah. Is it just reactive when someone asks for something? Or are we already walking through, like we do when we look at the guest experience? We look at the guest journey in hospitality, and we are amazing at this, touch points of how for people to feel like that we make their journey so smooth and seamless. Are we doing the same approach for our employees? Because that's where you could be very proactive with some reasonable adjustments. Thank you, Joe. So let's just remember that for many menopause symptoms linked to women's fertility cycles, periods, they are private and sensitive, right? So it's not something that although we want to normalize the conversation, we've got to be a little bit sensitive of how we approach that. And the biggest one really is how to have the conversations. Yeah. For some companies, we've actually done menopause pop-ups in the workplace, and they worked really, really well. And actually, it's probably been taken up more outside of hospitality and started now to get a lot more inquiries in hospitality. To do things on site or even virtual, it just can be really powerful to just bring this in and bring another voice in from external. But it's really important that if you're going to have conversations in the workplace or prepare your managers, that you feel equipped to speak to people on the subject, right? Where if you think about a woman losing confidence or not connecting the dots, can be a really emotional time. If you actually also think about other partners in the workplace, if their partner outside of the workplace is going through this, it can also affect them. So the more knowledge they have, actually it might help their relationships and also their performance too. So what are you doing in the workplace to support your managers, your well-being champions, HR teams? Yeah, how to have these honest and open combinations. Thank you, Joe. So basically there's an element of proactivity where an employee might identify it and want to talk to somebody. But then there's the other element, let me just put it to you, where actually colleagues will notice, managers will notice the symptoms manifesting of an employee before the employee connects the dots. So you might start seeing actually some employees, where their performance goes down slightly all of a sudden, or maybe they're suddenly late to work a lot more often. Now, there might be a multitude of reasons for that, not to mention the caring responsibilities I said they might have. But actually, when there's a change in someone's demeanor, behavior, sickness levels, it's really sensitive to have those conversations. And how many of your managers actually sometimes go straight in gung-ho and say, right, we need an investigation, let's look at formal process. Yeah, it's really important to actually take a little bit of an empathetic approach as to what might be going on. But sometimes, as I mentioned, employees might come to you. So how do you handle that? You cannot solve everything. And I mentioned before, we're not medical professionals to step in to talk about HRT and what supplements and things they need. What I can tell you is thank them, because if they've shared something like that with you, that probably took a lot, okay? Acknowledge what they're saying. Even if you want to ask a question and feedback, ask if they need support or want support, because they might just be venting. And then make sure you signpost, but don't just signpost, signpost it internally, but also might be externally, depending on what you have in place. I think the biggest mistake is that HR tend to know what there is, but not all managers are in tune with where to send people, right? So really important there. So not about giving unsolicited advice or diagnosis. It's about having open, trusted conversations, which what's we're great at hospitality, right? It's about relationships. So let's build on that. And lastly, thank you, Joe. Although some people, and there's no judgment on HRT or anything like that, and nor should you have any judgment on how other people choose to navigate this journey. The one thing that you should know, okay, and I can tell you just being at the Menopause conference last year, you know, the medical world is saying HRT does so much, that's great, genetics, all of this we know. The biggest control of your life in this journey are lifestyle choices that you make, okay? Now, I can think of a multitude of areas that hospitality can influence on this. I mean, we have amazing social activities. We have amazing community. We have resource groups, social committees. We've got events going on. We provide meals for our teams on site. Yeah. Have you ever looked at all of this from a wellness point of view, or looked at it from an inclusion point of view? Yeah. So really important to look at that. And in fact, some of the coaching programs, menopause coaching programs that we do, you know, it really is about each person finding a way to thrive in life and at work. Okay, but there's so much here that you could take forward on that journey for everyone. So in the interest of allowing Q&A, let me just say, sorry, thank you, Joe, you can go to the next one. Just want you to think about one thing right now. You do not have to be an expert in menopause to support somebody, okay? You do, however, have to cultivate open environment just so conversations can have, you know, so your team can flourish in that area. Yeah. Empowering women on this journey, for me, for everyone, it actually makes them thrive, and everyone's going to benefit from whatever you do. It will be a much more inclusive environment. So if you want any more information, resources, I will be sharing the slides as well as some key resources with the Institute of Hospitality, and that will be uploaded very soon onto the website. If you'd like anything in particular, or even just a complimentary chat, you've got a QR code here. Please book time, no problem. This is about moving our sector forward, about embracing and supporting our people, and actually just making sure that it shapes the future of how hospitality approaches this journey. Yeah, I'm also going to request it, you know, again, like I said before, it's a lot of information to give you. Today is about understanding and awareness of menopause and what you can do in the workplace to navigate and make that journey easier. But feedback would be appreciated. It takes 2 minutes to fill out 5 questions. And actually, there's a section where you can put your email address. So if there is something specific you want or would like to see in these kind of webinars, or like this conducted for you to be more bespoke, just let me know. I think it's really important not to overload you with information, but to give you the right one to inspire you to take it forward. Yeah. And last one, Joe. Just going to leave that up there in case you want to, number 1, book a call, or number 2, just follow on socials. We always give out lots of golden nuggets. And like I said, I'm happy to email or have a chat anytime. Are there any questions, Sam?
Thank you, first of all, Stella. That was really insightful and expertly delivered as well. Your HR and training background is clearly is paid off.
Passionate about this sector. Let's put it that way.
Yeah, no, it's very good. So thank you so much for that. It was brilliant. Lots of information. We do have some questions coming in. There's one question that's saying, if there's one thing that an employer could do as a result of today, one change that they could make today, what would you recommend they do?
You know, the funniest thing, sorry, firstly, thank you for that question, because it's always a great question to have, but it's the first question I'm asking on the survey I've just sent you. So I guess we're all on the same page there, right? So, because, you know, I think the main thing is, I think I started talking to all of you today by saying, actually, the one thing you could probably do right now is normalize this. This is happening. People are going through menopause. If we cannot have a culture or an environment where we can talk about this, when people are aware of it, where you've got things to signpost and you can normalize this conversation, that's the stigma that holds you back. And I'm sure you have that approach with mental health and other things that really, need to be talked about, because if we don't talk, we're not going to take action. Because regardless of what action you take, if people are not trusting and able to speak about it, they won't come forward. Yeah, so it really is important about incorporating that normalized conversation for me. Yeah, I think that's the first thing. Normalize the conversation is what I would say. And that might look differently. It might be coffee chats. It might be incorporating into L&D through chats. It might be doing a webinar like this. It might be getting your managers involved, because realistically, that role model behavior in leadership, if they're talking about it, your employees will feel safe to talk about it. So that would be the one thing I would say first. And the first step, you've taken it, if I'm honest already, you're here. So that curiosity, you've already taken a step. So thanks for that.
Excellent. Okay, so the next question is there any research that links menopause to sleep apnea?
I don't know the answer exactly to that question, if I'm honest. I'd love to get back to you on that. Sleep apnea, we know, is a different condition, right? So the one thing I'll say about menopause, it presents very differently in symptoms. And records also show that there's a lot of misdiagnosis going on. And what I mean by misdiagnosis is, gosh, they see the list of symptoms I shared with you today and say, oh, I think I've got that and that. I'll either self-diagnose or actually it's been known, and I hate to say this, it's not to trigger fear, but it's been known that a lot of people have gone to GPs and been misdiagnosed. There is a case on sleep apnea, but I'm not going to relate it because I haven't seen the research. There is a case I know with one person I've coached myself that were told by a GP after tests that they had sleep apnea. And later, after more tests, it wasn't. It was actually one of the many symptoms of their menopause journey. So that was interesting. What there is also misdiagnosis, believe it or not, in dementia. So some people are diagnosed with dementia, and actually what they're presenting actually are severe menopause cases, and that's the debilitating. So that's extreme, by the way. So again, I don't want to put fear in. If you specifically want to know the answer to that question, I will do some research. I'm a member of the British Menopause, so I can literally look into some of that. But I do quite honestly tell you there is a lot of misdiagnosis going on. GPs are being retrained, just to give you a bit more information. They're being retrained. Why? Because in the past, the first thing they would do is either try and put you on HRT, or they wouldn't connect the dots. And sometimes that was because women come with one symptom and a month later present with another symptom, and then a bit down the line, another one, and nobody was taking the three symptoms together. So I've actually got a menopause checker. I can share that also with the Institute, because that way you'll have resources that your employees can just have and say, the best thing GPs are asking now is that you come with all the symptoms on a checklist and present, so that they can be a little bit more informed. Remember, they've got 15-minute slots usually. So they've got to look at something and know where to signpost and how to handle it. But there has been misdiagnosis. So that I know for sure. But I can do more digging if you'd like. Let me know, please.
And I guess because that slide you showed, there was 41, was there 41 different symptoms?
There are more. These are the main ones.
Yeah,
there are
so
more.
that's why I suppose it can get very confusing, can't it? What?
Absolutely. I had one case of somebody I was coaching. Actually, it was leadership coaching, but menopause just happened to come in there on that leadership coaching. But she presented with electric shocks. So if you can imagine feeling electric shock, that is actually, it's a very rare one, but it is a menopause symptom. Yeah.
Wow.
Interesting.
Well, I've got lots of questions coming in, Stella, so have another swig of that water.
Okay. It's only water.
What somebody's asking, could they have access to the case studies from the hospitality industry?
Yeah. From hospitality. Okay, I've got case studies on menopause. I'm not sure that I've got specific to hospitality sector. I've got some in terms of workplace, but not individual symptoms ones. Is there any? I tell you what, I'd love to know, sorry, from whoever made that comment. I can share some case studies. If there's something specific you had in mind when you asked for that, could you just reach out and let me know? Because, just re-ask it or reach out to me and just shoot me a little note. There's my email there, hello@Wellbeing. would be good for that one. Just so that I can give you the right case studies, because trust me, I have a lot. I use a lot in training, and I use a lot, and I refresh them just to make sure they're current. Yeah.
Excellent, thank you. So another question, have another swig. This is a long one. May I ask, in your experience, how would you compare the severity of menopause symptoms versus andropause symptoms?
Okay. All right. So
We said ask them hard. We said ask some hard ones, didn't we?
yeah. You know what? Similar, because you're talking about changes. But I think ultimately there's not as much research in that as there are in what we've got to, and there a lot more research needs to be done, let me put it that way. And I've not done a comparison or seen a comparison. And I haven't studied that as fully, but there are a lot of, because it's declining hormone. So the moment you've got that, you're affecting, right, your cognitive behavior. They're both still similar effects. So cognitive behavior, physical, and and different mental, emotional is what we call effects. So all the same. Having said that, it's a different hormone that's affected the most. So you're probably talking more about testosterone. Hormone is probably affected a little bit more there than the estrogen decline, and that's different things, right? Testosterone, and women have it. It's the libido side that gets affected. It's so there are real differences in that sense, but the change and transition effects are similar. The research that I've seen are not as severe. So menopause can be more severe, and it also lasts a lot longer. I will find a resource on that and share that one. Yeah, but that one I'd have to dig out to make sure it's current.
Well, you've got lots of homework, Stella, from this.
I do. I'm glad this is recorded so that but I'm just jotting down. Yeah.
Another question is there any research that looks at the menopause from a cultural perspective?
Yeah, a lot more in the US, I'm going to tell you right now. Great professor here, Vikram Telawika. I follow him on LinkedIn. I've met him in person. I've done work with him. Women of a certain stage who I qualified with who are great, also very important, involved, and the British Menopause Society. But there's more research in the US at the moment. I think they're looking more at the D&I perspective, whether they're just going ahead than we are, and taking that piece a lot more seriously. But having said that, we can learn a lot even just from the research from the US, because it's a very global approach, right? And very different ethnicities. Not enough of that here, if I'm honest. But there is definitely differentiators, because I spoke about genetics. And the biggest one when I talk about genetics is if a woman's going through menopause, quite often, if they want to know how it's going to be for them, if they have the ability to have a conversation, if they have that opportunity with their mother, for example, because that is a very strong genetic gene. But the cultural differences could be environmental, weather, the type of lifestyle they have. Remember, I mentioned lifestyle is your biggest key here. So depending on where you come from culturally, that could really impact your symptoms. I'd like to see more. We need more research in the UK, but there is some. Majority is from the US.
Brilliant, excellent. I think, Stella, we've come to the end of all the questions. You'll be pleased to know.
No, I don't mind them at all. I just want to make sure I'm answering them properly, because obviously you ask a question, but I don't know if I'm hitting what you need in my answer. If you need to dive deeper, again, I've left the QR code up there. Please do reach out, and I will share some resources, but I need to make sure the resources are a bit timeless, or at least updated and refreshed, just so they fit the purpose. But please reach out. It's a complimentary chat. This is something we're doing to support you, because you have a tough job as leaders in HR and with a workplace lens of what influence you have. But actually, maybe it's personal. Maybe it's affecting you on the call. Maybe it's affecting a loved one. And taking a human-centered approach, I think, is fundamental with what we do. But I am very practical. I am very financially aware of our sector. This does not have to be a costly investment to make a change. It starts with conversation and little changes. Yeah. So yeah,
Excellent.
reach
Well, I think that's a
out.
great way to finish, Stella. Thank you so much. A great way to celebrate Menopause Awareness Month as well. So,
Isn't
what
that
a great
fabulous?
way to finish that. And we can all go trick or treating tonight with with that knowledge in our hats,
Oh,
knowing a little bit more
but
about menopause. So,
yeah, but let's
yeah,
take the fear away. Let's sell it. This is a change and transition piece. It's a new opportunity piece. And if we can get that a little bit easier, not easy, but easier, then that's something to celebrate, right? So thank you very much for having me. Really enjoyed
thank
it.
you, Stella.
All right,
So thank you, Stella, and please pass on our regards to Kelly, and hope she
will do. Thank you.
feels better
Bless her.
soon.
Thank you.
Just to remind everybody that's listening, this does count towards your CPD hours, so please do record that in your members dashboard area of the website. And our next two webinars is the next one is on the 6th of November, so next week, around clearing the fog around the budget 2024. So the autumn budget was yesterday. As unless you've been living under a stone, you've probably you've missed it. But we're going to bring an expert panel together next week to discuss the impact of the budget on hospitality. And then the week after, we've got a second webinar around budgeting, forecasting, and cash flow within the hospitality industry. So how to do those simple business functions and the importance of those within it. And they'll be our last two webinars of 2024. So thank you, Stella, again, and
Thank
thank
you.
you, Kelly, even though you're not here.
No,
We
she's
look forward
here.
to, yeah, she's here. We look forward to seeing you all again soon, and hope you have a lovely rest of your afternoon. Take care. Bye
Thank
bye.
you. Bye.